Thank you, Mr. Chairman, and thank you to the witnesses for being here today and for your testimony. After years of working families struggling to afford the cost of child care, I'm glad to see that this committee has finally decided to hold a meeting, a hearing on this subject, because child care is hard to find, and it's even harder for working families to afford. This is a crisis, and Congress needs to work tirelessly to ensure that our children are cared for. What sort of solutions are Republicans bringing to the table? Well, the Department of Labor cut child care for its employees, and the president isn't requesting any additional funding for Head Start. As Maya Angelou reminded us, when someone shows you who they are, believe them. House Democrats are working to make child care more affordable and to ensure that child care workers can make the ends meet. We're introducing legislation, as you've heard, like the Child Care for Working Families Act, because we understand that, as Marion Wright Edelman said, that the future which we hold in trust for our own children will be shaped by our fairness to other people's children as well. Dr. Friedman, child care professionals in a center earn an average of $33,140 per year. And that puts many child care workers in the position of not being able to afford child care for their children. So can you tell us more about the child care workers in this country and whether most of them can make ends meet based only on the money that they make from working in a child care center, and how do these wages impact the child care workforce?
Thank you. So, as you said, the child care workforce is one of the lowest paid professions in this country, despite the very essential and important work that they do every day for families and for this country. The real problem is that parents can't pay higher fees, and providers can barely keep the staff that we have. In talking to providers over the past few years, what I heard over and over again is they continue to lose staff to places like fast food or Costco because those places pay better and have better benefits. And unless we address the wages of the child care workforce, we will not have enough child care in this country.
Thank you. So because of low wages, many care workers rely on public assistance in order to survive. And researchers at Berkeley estimate that 43% of the child care workers, the families, rely on some kind of public assistance like SNAP or Medicaid to survive on these insufficient wages. Some of my colleagues across the aisle might be under the impression that recipients of Medicare or SNAP do not work, but that's just not true. Dr. Friedman, if cuts to Medicaid or SNAP made it impossible for child care workers to make ends meet, what would you expect to happen? And would they be able to keep working? And now, if those workers didn't keep working, what would the impact be on child care costs and availability for other families?
I think the proposed cuts to Medicaid and SNAP are very, very dangerous for the child care workforce. About 30% of child care workers count on Medicaid. In expansion states, child care workforce has health insurance at 4 times the rate of states who did not expand. And so if those cuts go through, you're going to see that the workforce cannot make ends meet, and they will leave their child care jobs for other jobs. And as a result, we will see the child care supply in this country go down.
Thank you, ma'am. In your testimony, Dr. Friedman, you mentioned the Department of Government Efficiency cuts at the Office of Child Care. So could you provide more details about what those employees did to support the Child Care Development Fund and how these firings will impact the administration of the Child Care Development Fund?
Absolutely. So Congress just recently gave the Office of Child Care the resources it needed to support implementation of CCDF. And those staff were doing a variety of things. One of the things that we heard from states is that the Office of Child Care was not responsive enough quickly with state questions, and that we needed more timely responses. We needed more timely monitoring so that they knew what they were doing and what they could be doing better. In addition, the 5 offices, regional offices that closed, those experts very closely worked with state agencies to maximize the state flexibility and state dollars. So we lost all of that expertise, and by cutting the staff by 50%, everyone has to do another job. You can't do the same job. You can't support the program. You can't oversee the program correctly.
Right. Thank you very much, Mr. Chairman. I yield back.